jump on in then and start talking. We finished up the ovary last class, and today what we're going to be talking about is going to be the uterus, the fallopian tubes, and then some of the female external genitalia. Okay, so let's do just a few labeling here. Make sure that you have these items, all right, labeled in your lab atlas if you haven't done so already. All right, we can see here, all right, that's the fallopian or uterine tube. At the very end, you have these finger-like structures. Those are referred to as the fimbria. All right, and then the fimbria, medial to the fimbria, we have the infundibulum. After the infundibulum, all right, we have the ampulla. This is usually where fertilization will take place. All right, and then finally, just before we get to the actual uterus here, we have the isthmus. And then our uterus here is made up of 3 layers. Okay, rule of threes here. The outermost layer, which is continuous with the broad ligament here, the peritoneum, all right, that's known as the perimetrium. All right, the muscular layer is going to be the middle layer. Easy to remember, that's going to be myo. Myo is muscle, myometrium. And then the inner layer here is endometrium. And you probably, some of you may have heard of endometriosis. And that's usually how I remembered it, is because with endometriosis, that's going to be on the internal portion of the uterus there. All right. And then the space inside is going to be the uterine cavity. So a couple other structures here that I do want to point out. All right. Here you can see the ovary. All right. Part of it is going to be within the broad ligament. Here you can see we have the ovarian ligament attached here. All right, and that is covered, all right, again with the broad ligament. Think of the broad ligament as just like a sheet that's just being draped over the structure. Both of our fallopian tubes, all right, the uterine cavity. All right, and this area here is the cervix. And I guess the best way for me to explain what the cervix is, go away, all right, is a donut, okay? And so with the cervix, kind of like a donut here, trying to do my best to draw a 3-dimensional image here. All right. Okay. So kind of like what we're seeing here, when we're talking about the cervix, all right, you're going to have an opening here, which is called the internal, all right, cervical os, which is the opening. That's what this little circle is representing. Okay. And then here at the bottom, all right, of the cervix, you have the external cervical os, which is this guy right here. And there's a little kind of tunnel or passageway in between, and that's the cervical canal. Okay? And so that's the best that I can do with my horrible artistic skills here. All right, broad ligament, ovarian ligament. All right, here you can see the vagina with these folds here. We refer to those as rugae. That hasn't changed. I think that's everything. And then the fallopian tubes and the ovary there. All right. And then our actual uterus has 3 different parts to it. Okay. So similar to like the stomach, you know, you had those different regions to the stomach. Well, the uterus has a fundus also. And the fundus is going to be located in between where the 2 fallopian tubes will enter into the actual uterus. We have this dome-like portion here. That's going to be the fundus of the uterus. The majority of the uterus is known as the body. And then down here at the inferior portion here, that's going to be the cervix there. Okay? And the cervix, again, is made up of both the internal, external cervical os and then the cervical canal here. All right, so let's talk about some of the structures here. We'll start with the uterine tubes, or the fallopian tubes. All right, and then we're going to work into the uterus here, okay? So the fallopian tubes, all right, will have a couple different regions. Did I skip it? Oh, I guess not. Oh, I think I may have left a slide out, but that's okay. That's okay. All right, when we're talking about the fallopian tubes here, all right, we're looking at I'm going to work my way from the most medial portion and work my way laterally. The isthmus here, all right, is going to be from the external view of the fallopian tube, that part of the tube that you will see that is going and connecting, all right, to the uterus here, all right, because the actual part of the fallopian tube that actually inserts itself into the uterus, we refer to that as the uterine part, all right, but that's usually where the fallopian tube is penetrating the wall of the uterus. So on the external view, you'll see the isthmus here, all right, that's the most medial portion of the uterine tube. Lateral to that is going to be the ampulla, and it's an expanded region. So if you look at it, it's kind of like a little bit of a, I don't want to say a bulge, but it kind of expands like this, all right? And that's usually where we're going to see fertilization take place, because it takes about 6 days. Once the egg, or the oocyte, excuse me, is expelled from the ovary, it takes roughly about 6 days to get there, all right? So it's a pretty decent time, and it varies, but on average, it's about 6 days. So if you think about it, during intercourse, the sperm has to travel up through the vagina, into the uterus, and then into the fallopian tube. So it's got to kind of, I won't say meets it halfway, but they have a distance to travel too, okay? So this is going to be the area where normally you'll see fertilization occur. All right. Now, when we look at the walls of the fallopian tubes, okay, there are 3 layers. Again, rule of threes. We're going to see that quite a bit. And we just got done with the digestive system, so we should be pretty familiar with the terminology. The innermost layer is going to be the mucosa. The middle layer, of course, is going to have all the muscle. Then the serosa is going to be the outermost layer. We call it the serosa because it's covered by serous membrane, okay? If it's not covered by a serous membrane, do y'all remember what we call it? Adventitia, yeah, okay. So the innermost layer, and we talked about this briefly in chapter 5 when we were talking about tissues, is going to be lined by simple ciliated columnar epithelium. The cilia are going to beat back and forth, and that's what's going to help to propel the oocyte towards the uterus. So it's going to be in the direction of the uterus here, all right? Now, in this case, when we looked at the vagina here, you saw these rugae folds here, all right, and those are transverse folds, all right? But in the fallopian tube, we're going to deal with longitudinal folds. I got to find where I left off. All right, so these longitudinal folds are going to go the length, all right, of the fallopian tubes, all right? But because of those longitudinal linear folds there, all right, it does actually decrease the lumen size. So if you, I'm going to try my best to draw this, all right? It's going to kind of look like this. All right, if we were to take the fallopian tube and just cut it sagittally. All right, so these folds are going to kind of impugn or move into the lumen here, so it does make it smaller here. All right, but again, on these folds, we have that ciliated columnar epithelium that is going to help to move that oocyte down towards the uterus. Then, of course, the middle layer, the muscularis layer, is going to have 2 layers of muscles. All right, the innermost is going to be the circular layer. The outer is going to be the longitudinal. Right, and in addition to the cilia helping to move the oocyte down, these muscles will contract, and that too will help to move, if fertilization takes place, helps to move the embryo, because we're in a rush now. All right, if the oocyte is fertilized, now it's a race against time, because we have to make sure we can get the embryo to implant onto the uterine wall, all right, so we can start the development period or phase here, all right, for our embryo, okay? But again, because over a certain amount of time, if there's no implantation, what will happen? You get washed out. Yeah, it gets sloughed off. That inner layer there, the basilar layer, well, not basilar, but that inner layer, all right, will get sloughed off, because the body thinks, all right, there's no fertilization, so we have to hurry up and get that fertilized egg to the uterus for implantation. That's our goal. And then the outermost layer here is the serosa. Again, that's part of the serous membrane now, okay? All right. I don't really think that the uterus looks like a pear, all right? But if any of you have seen a pear, all right, apparently that's what it looks like. I don't know. All right, but you know that the larger portion is going to be the superior, and then as we start to get down to the inferior portion, it starts to taper down. All right, and then at the inferior portion, that's where we'll see the vagina. Now, the uterus can be in two positions. And most of you in here, and I'm assuming all of you, I shouldn't say most, all right, are going to have it in the anteverted position. All right, the anteverted position is what we saw way here. All right, now this is an anterior view here. All right, so an easier way to look at it is from the lateral portion. All right, you can see how the uterus, all right, the body and the fundus are in the anterior position. Okay, and that's going to be in younger females. Retroverted is when this whole thing flips backwards, back against the rectum there. All right, easy to remember, rectum is R. All right, and retroverted is also R. So, but we'll see that in an older population.
Why does that happen?
Part of it has to do, who asked me that?
Me.
Oh, okay. Part of that has to do with as we age, all right, just like with anything, ligaments, you know, they don't because we're going to talk about all the ligaments and all the structures that hold the uterus into place. Muscles weaken, all right, the muscle of the uterus especially too. That will also weaken, but the ligaments that hold the uterus in that position won't be as taut, and so it can, I hate to say flop, but it positions itself, okay, back like that. All right. Where am I? Nope, that's not it. Okay, here we go. Okay, so the functions of the uterus are basically one, all right, for a site for implantation for the embryo. All right, so once fertilization occurs, we need a place for implantation. Okay, two, if that is a fertilized egg, all right, then we actually need to sustain, all right, the embryo for development. So we are going to kind of do some major renovations in this region and eventually develop that placenta, all right, and we'll talk about that in chapter 29 when we get into development, all right, placenta, which is going to house the embryo, the fetus, all right, and then for the development and support that fetus there, okay? And then when it's time for birth, all right, the uterus is going to help assist that birthing process by, and I hate to use that term, ejects the fetus, but it helps to expel the fetus, all right, during the birthing process with the muscular contractions from the myometrium there, okay? If there is no fertilization, then we have to shed the lining there, okay? And so before we get into the actual layers of the uterus, I do want to talk about, all right, just a quick review here, the parts, the regions of the uterus, okay? The fundus is the superior-most portion there at the top. You'll find it in between both of the fallopian tubes there. All right, the largest portion of the uterus is the body. Okay, that's that area where we start to see the tapering down, all right, of the uterus. And then where it starts to get pretty narrow, that narrowing portion, that's the isthmus. And then at the inferior portion of the uterus is where our cervix is, right down here. And on the other side of the cervix, that is going to be, of course, where the vagina is located, okay? Speaking of the cervix, we've got the cervical canal, which connects the interior and external cervical os, all right? And then the internal cervical os is going to open up into the uterine cavity, and the external cervical os is going to open up into or connect to the vagina. Now, this is the area in which the physician goes in and performs the pap smear. Okay, have you ever had a pap smear? Again, they're sampling, most importantly, non-keratinized stratified squamous epithelium. Right, and so that's where they're taking it from, off of the external os here. Normally, there is a mucus plug there. The mucus plug is very helpful because it prevents, all right, infection. All right, and it is from, all right, those mucin secreting glands located in and around the area. Now, that mucus plug during ovulation, all right, around day 14, starts to thin out. Okay, you start producing less mucin, all right, and that allows and makes it a little bit easier for sperm to penetrate and enter into the uterine cavity, all right, to make their way up towards the oocyte there. Okay, so a couple structures that are going to help support the uterus, the round ligament. All right, the round ligament is going to attach to the superior portion. I'll show you a picture in here in a second. And it helps to suspend the uterus upright, but also the round ligament, and we didn't really talk about this too much, but you have what's known as the inguinal canal. And the inguinal canal is this tunnel that goes from the superficial area down near your groin up into the internal portion of your peritoneum, of the pelvic cavity there. All right. In men, in our inguinal canal, our spermatic cord travels in that area. All right. In ladies, all right, you have round ligaments that will travel in there. All right. The round ligament also attaches onto, all right, the labia majora. That's part of the external genitalia that we'll get into. The transverse cervical ligaments help to hold the lateral portion of the cervical, of the uterus to the pelvic wall there. All right. The uterosacral ligaments obviously are going to attach the uterus to the sacrum. And then the muscles of the pelvic floor, the levator ani, okay, and the urogenital diaphragm muscles there. All right, those are the same muscles that play a role in the external urethral sphincter, all right, for potty training, toilet training. All right, these muscles that make up the pelvic floor help to ensure, all right, that the uterus stays in place. And unfortunately, if you've ever heard of the term a prolapsed uterus, it's usually a result of these weakened muscles here, all right, that can occur and can cause part of the uterus to move out through those areas there. Because in women, you have one additional opening into your pelvic floor. Men, we just have an opening for the rectum and the urethra. You have 3 openings for the rectum, the urethra, and then also for the vagina. All right, so that's just an additional area in which you can have a weakness going on there. All right, so like I was saying here, the round ligaments are going to be on the superior lateral portion of the uterus here. All right, and it helps to hold the uterus upright, okay, and it's going to enter into the inguinal canal. All right, the transverse cervical, they're going to be on the lateral sides here, all right, and they're going to attach, all right, the uterus here to the pelvic wall. All right, the uterosacral ligaments are going to attach to the sacrum, okay, and then, of course, like I was saying with the prolapse there, unfortunately, it has to do with the weakness of those pelvic floor muscles that'll allow part, all right, of the uterus to protrude through those weakness areas in the pelvic floor out through the vagina. Okay, 3 layers, all right, of the uterus, all right, perimetrium, the myometrium, and the endometrium, okay? So the outermost layer is going to be contiguous with that broad ligament, which is part of that serous membrane there, all right, that's going to cover not only the uterus, but also the fallopian tubes, parts of the ovary, all right, the ovarian ligament and whatnot. All right, the myometrium, this is the layer that is going to undergo a lot of work during, all right, delivery, because as the uterus grows in size, all right, the smooth muscle here, all right, is actually going to be the active tissue during the contraction period. All right, so in this situation, all right, most times when we're talking about the middle muscle layer of anything, we're usually dealing with 2 layers, a circular layer and a longitudinal layer. Right, in the stomach, we had 3 layers, all right, and guess what? In the uterus, we have 3 layers, all right, but for the most part, it's usually going to be the middle muscle layer is usually going to be 2 layers, but here, all right, like the stomach, we're going to be dealing with 3 layers. And then the innermost layer, the endometrium here, okay, what's special about the endometrium, all right, is that one, all right, you've got 2 layers on the inside, all right, that are going to play a role, all right, in when we're talking about menses here, okay? So first of all, we have our simple columnar epithelium that is going to line the inside of the uterus there. Of course, all epithelium sits on a basement membrane, and then just underneath that basement membrane, we have the lamina propria. Now, the lamina propria is going to contain all of these glands here, all right, especially those who become much more active, all right, if fertilization takes place, all right. But then what we're going to see here, all right, we'll see two layers adjacent to those regions. We've got the basal layer, which is always there, okay? And we're not going to see too much going on in the basal layer. This layer, the functional layer, is the one whenever you hear the term sloughing off, all right, or during menses, this is what we're talking about. This layer during fertilization is going to be the layer that's going to increase in thickness. It's going to increase in vascularization, all right, to help support, all right, all the additional tissues and especially the developing fetus. And when we get into the placenta, all right, this is also the layer that when we were talking about last class, all right, that the corpus luteum, all right, when it's releasing progesterone and estrogen, this is the layer that we're referring to, all right, because of those hormones. All right. Just another quick review here of, make sure you got everything labeled here, all right? When we're talking about the fallopian tube, here's our fimbria, all right? The infundibulum, which is that kind of funnel-shaped portion of the fallopian tube, all right? And then we're dealing with our isthmus, or the ampulla here, and then the isthmus here, all right? Ovary, okay? Then you can see the layers here of the uterus, this outermost layer. All right, that's what we're looking at is the perimetrium. All right, and then the middle layer, there's our myometrium there. And you can see, all right, when we're looking at the perimetrium, you can see that here's the broad ligament just kind of hanging over everything. All right, the ovarian ligament attaches the ovary to the uterus here. Okay, any questions about any of that stuff? Okay. All right, here's you've probably seen all this too, all right, from last semester. We were talking about a couple of these structures. You can see here's the uterus, all right, with our fallopian tube, and here's the ovary, which we didn't label last semester. Here you can see is that round ligament. And it again comes off of the superior lateral portion of the uterus. You can't really tell here, but it's heading up towards the inguinal canal, all right. And then down here is the vagina, and then some of the external genitalia here. All right. Let's see. Down here is the labia minoris. All right. And then just lateral to that, a larger structure is the labia majoris. All right. And then at the top, you can't really see it very well here, is the part of the external genitalia is the clitoris here. All right, pretty much hit all this stuff here. Yeah, and then the only thing that's new on this one here is the mons pubis here. And we'll talk about all these structures here in a moment when we're talking about the external genitalia. All right, please don't confuse this, and I'm not trying to make fun of anybody, all right, seriously. All right, but understand the order and the positioning of these structures. All right, the urinary bladder is going to be the most anterior, all right, structure, and then you have the uterus, and then posterior, right behind that, just in front of the sacrum, is going to be the rectum. All right, I've seen that people get confused on that, and so I just don't want anyone to lose any freebies on the exam. All right. Inferior to the uterus is the vagina, okay? The vagina's job is simple, okay? It will function as the birth canal during child labor, all right? And then also during intercourse, this is where the male genitalia, the penis, will be inserted into. And then also, this is going to be, all right, during the menses, during menstruation, when the endometrium gets sloughed off and the functional layer gets sloughed off, this is where it's going to lead through, okay? All right, couple things with the layers here. The innermost layer, all right, is going to be made up of that non-keratinized stratified squamous epithelium. Again, the mucosa layer is going to be a layer that's going to undergo mechanical stresses. all right, for those reasons that I just mentioned on the previous slide here. All right, so it's not a good place to have simple epithelium. You want to have the stratified epithelium. Also, we'll see that in the vagina, you have these acidic secretions that are great and helpful for preventing infection, but those acidic secretions are not a very good environment for sperm. Okay, so we'll discuss that during that period of intercourse and during ejaculation. Semen, all right, has in it substances that will help to counteract the acidic secretions here located in the vagina. All right, I mean, like I said, the acidic, you want to have the acidic secretions because it's great to help to prevent certain pathological infections, but at the same time, it's not very good for semen there. Middle layer again, the muscularis. Again, you have those two inner and outer layers. One is circular and one is going to be the longitudinal. And then the outermost layer is the adventitia. All right, adventitia we call it because obviously it's not part of a serous membrane. All right, but the inner layers are going to be loaded with elastic fibers. All right, so that tells us that, and it makes sense because during the birthing process, all right, we need to have this structure being able to accommodate child delivery, and the baby, we need it to be able to expand, okay? And then the outer layer is going to be made up of that areolar connective tissue, which is just going to be loaded with vascular structures. All right, let's cover some of the external female genitalia here, all right? We refer to it as, obviously, external genitalia, or you can call it the vulva. All right, the first structure is the mons pubis. This is going to be an anterior superior region just, all right, in front of the pubic symphysis, okay? Pubic symphysis is about 2 to 3 inches below your umbilicus there, all right? And this region here during puberty is the area that's going to develop pubic hair, okay? Then we have the labia majora here. All right, these are going to be the larger thickened folds here of skin in CT. Important to know this, it is homologous to the scrotum in males. All right. Also, after puberty, this area is covered with pubic hair. All right, and it's loaded with sweat and sebaceous glands in that area there. We don't cover it in this class, but it's really interesting. How essentially during the fetal development, if the proper hormones aren't present during the fetal development, it can sway. And I'm sure you've probably heard of people that have had both male and female genitalia. Hermaphrodites was the term that they use. I don't know what the current term is, if they've changed it all. But you can see where these, depending on the chromosomal genetic makeup of the fetus, and depending on what hormones are being produced, certain structures are either destined to be, for example, labia majora in a female, it will be the labia majora. But if certain hormones aren't present, all right, depending on the genetic makeup of the individual, all right, we'll have the scrotum. I'm not really explaining this really well because it's fascinating stuff, but my mind's just not there. Sorry. I don't even know why I went off on that because I had a really good point to that. No, it's usually because there's going to be certain structures that are homologous to one another, and for example, like the clitoris. All right, parts of the clitoris, which we'll talk about, are going to be, again, homologous for females and the male, like the glands of the clitoris. Hold that thought. I'll get to that. I'm going to show you. But no. So going on to what you're saying for the internal structures, I have not heard of anybody having that type of scenario, like an XY chromosome male being born with ovaries, or an XY male being born with a uterus. Certain things are definitely, it can go either way depending on what hormones are present during the development stage, and you'll either get, I know that sometimes you can get both, but usually if there's proper hormone expression, then you're either going to get a scrotum or you're going to get the labia majora. You're going to either get a clitoris or you're going to get a penis, that sort of thing. And we'll talk about some of this, and I'll point out some things here. Internal, or more towards the medial portion to the labia majora, you have the labia minora here. All right, now this area is highly vascularized, all right, and you'll see during intercourse, this area gets engorged with blood, and we'll talk about some of the other structures that do. All right, but what we'll see is, most importantly, all right, there's no hair on the labia minora, all right, but we will see, excuse me, I can't talk. We will see sebaceous glands also, all right, which is interesting because there's no hair, but we'll have sebaceous glands there. And we're used to seeing sebaceous glands associated with hair follicles, all right? But we'll have melanocytes present there. So usually this tissue, all right, will be darker in color compared to the labia majora, all right? And then just internal to that, actually I hate to use the word internal, but just inside of the labia minora, there's this space here, and that's called the vestibule. So on either side of the vestibule, you'll have the labia minora, all right? And in the vestibule, you'll see two openings, all right? You'll see the opening to the urethra, and then you'll see the vaginal opening. I don't know why I'm drawing it. I'll just show you. It's way better. All right, so here you can see, all right, here's the mons pubis here, okay, just in front of the pubic symphysis, all right? So here again, you can see further out to the lateral portion, here's the labia majora, and then just deep, I hate to say deep, but more medial, all right, we'll see here's the labia minora, all right, not covered with hair. It's going to be a little bit darker because there's a higher presence of melanocytes there. And then in between the two labia minora, we'll have this area here, this space here, that's the vestibule, all right? And then you'll see the urethra opening more anterior, or in this picture, it's more superior. And then just below that, the opening, or the vaginal orifice there, okay? And what we're seeing here, this little rhomboid, I guess you would call that, all right? There's a name for that. We call that the perineum, not to be confused with the peritoneum, all right? A lot of folks will confuse that. The perineum is this area here that pretty much goes from the pubic symphysis, all right, to the ischial tuberosities on either side and to the coccyx here. You can't see it because we have the overlying structures there. But all of that, all right, is going to be the perineum. I just didn't want you folks to get confused with that, okay, in case you heard that term or were reading it. I skipped. Okay. So, all right, so the bulb of the vestibule, all right, now we're going to start to talk about some of the structures. They're part of the external genitalia, but you can't see them because there's skin and other tissues that overlay them. The bulb of the vestibule, and I'm going to just jump back and forth on a couple of these. All right, so going back to this view here that we saw of the perineum here, here's the bulb of the vestibule, all right? And it's this tissue that lies on either side here, all right, of the vestibule, okay? And the bulb of the vestibule is going to be an erectile tissue, okay? So during intercourse here, all right, that area will become engorged with blood, all right? And what we'll see is an increased sensitivity, all right, for pleasure, all right, during sexual activity here, all right? And a lot of that has to do with because we've increased the blood flow to this. And so when we get to the bulb of the vestibule again, in the males, we have a similar tissue for the same thing during intercourse, all right, that we'll get, and we'll talk about that in a moment, not in a moment, but we'll talk about that next class. All right, at the base of the bulb of the vestibule, we'll have the greater vestibular glands. And their job, I'll show you, is to help secrete mucin, all right, which is going to help produce mucus. So you can see here, here's the bulb of the vestibule. At the base here, all right, you'll see the greater vestibular gland, and these glands will help to secrete mucus, or excuse me, mucin, which will help with mucus production, especially during intercourse, all right, to help decrease friction there and add some lubrication. I'm trying hard not to have this sound like a rated X movie, okay? I'm trying, okay? All right, Then, now since we were talking about homologous structures between males and females, the clitoris is that homologous structure. Okay, so it's made up of a couple parts, and some of these terms will be similar when we're talking about the penis. Okay, so when we talk about the clitoris, we have the body, the crus, and the glands. Okay, and the penis has all the same structure. So again, hormone development will determine whether or not one has a clitoris or a penis. All right, but again, this is another erectile structure here. All right, which if we follow both the labia minora all the way up to the top of the vestibule, all right, this is where we'll see the clitoris. I know I keep trying to draw. It's hard to really see it in this picture here. All right, well, that's not bad. All right, so there's the urethra opening. You can see the labia minora here. Follow where they both come up, all right, and where they both come together just below that, all right, you'll see part of the clitoris, all right, the tip of the clitoris, which is called the glans, all right. We call it the glans of the clitoris. On the males, we call it the glans of the penis there, all right, but both are the same, all right, when I talk about their relationship to one another, okay. I know I'm skipping back and forth a lot. All right, so again, this is another structure when during sexual intercourse, all right, it becomes engorged with blood, all right, and it can become erect, but it has plenty of nerve receptors there for pleasure during intercourse here, okay? So when we talk about the three parts of the clitoris, the body, the crus, and the glans, all right, the body is made up of the corpus cavernosa. And the corpus cavernosa are these two structures right here. Again, another erectile structure. But here is, all right, the body, or not the body, the corpus cavernosa here. All right, they're going to be located, I'm showing you the wrong, this is the crus. The crus then give up, the crus are individual that then provide the corpus cavernosa when they both come together to form the body. At the tip of the body is the glans right there, okay? But the crus, all right, the crus are going to sit right there at the base of your pubic arch. And the pubic arch is the inferior pubic ramus. If you remember when we were talking about the pubic bone there, you had the superior pubic ramus, which was above the obturator foramen, and then the inferior pubic ramus, which was below the obturator foramen. All right, well, the crus are going to attach onto the pubic arch. And from each of those crus, all right, is where we'll get the corpus cavernosa, which will then fuse together to form the body of the clitoris. At the end of the body, all right, is the glans, and that sits right on the top there. And then above the actual clitoris is what we call the prepuce, and this is where both of the folds of the labia minora come together, and it's also referred to as the hood. Well, there's two parts. There's the corpus spongiosum and there's the corpus cavernosum. Both of those structures can fill with blood during an erection. The part that can break, I'm not quite sure which of those it is. I would have to say, though, that it's most likely going to be the corpus cavernosa, because the corpus spongiosum is where the urethra is going to, the penile urethra. So it would make sense. I just would not want to experience that. You know, I've heard of it, and I'm sure it happens, but and I'm sure for those of you that are going to go into the medical program and whatnot, you're going to see some really interesting stuff. So when I took a radiology class, I saw some really interesting radiographs that people had. Really crazy. All right. Oh, okay. I just wanted to zoom in here. Case, you're making me lose my train of thought. All right, that's all right. So here's the labia minora. They both come up, all right, and where they come together, there's the prepuce right there, and then just below it, that's where we're going to see the glands of the clitoris. All right. The last one right here, just to show you here, all right, we're following, all right, when we're talking about the different organs here, here is your urinary bladder. Oh, I should zoom in, it's tough to see. All right, and you can see here is the urethra All right, and so the opening here is going to be the urethral opening, all in the vestibule, and then here again we can follow the uterus down through the vagina, and then the opening here, all right, in the vestibule is going to be the vaginal opening there. All right, so you can see where they are in relationship to one another. Okay, keep in mind what makes up the lateral walls of the vestibule are going to be the labia minora there. And that's going to be it for this. Any questions? All right. I always kind of feel like when I'm teaching this female anatomy to females, like you all have a pretty good idea, you know, but I can't assume, but still, some of that. So any questions? Anybody? No? Okay. All righty. Well, that's it for tonight. Okay. Yeah. You're very welcome, Emily. You have a good night.